Let's do it! Hey guys, we are going to get started with your maternal and child overview by talking about the pregnancy lecture. Let's get started by knowing that the hormone responsible for pregnancy is the HCG hormone. I have that written down for you, so now you only have to take notes of the things that I'm continuing to say. We are going to look at the probable versus positive signs of pregnancy. You have to know this for NCLEX. So there are 3 probable signs that I want you to be familiar with. The first one is Hagar's sign. Do you know what Hagar's sign is? It is a softening of the uterus. Number 2 is Goodell's sign. Sometimes people get Goodell's sign confused with Hagar's, but Goodell's is actually a softening of the cervix. And the third sign is called Chadwick's sign. This is where you will see a bluish discoloration of the vagina and cervix. The fourth probable sign of pregnancy is actually 2 things. The first is all blood tests and all urine tests. That's right, a woman can be looking at a positive urine home pregnancy test and still not be pregnant. Can you think of why a woman would have a positive urine home pregnancy test but not be pregnant? The body can actually interpret tumors in the uterus to be pregnancies or other things that are not babies. So all blood and urine tests are always considered just probable signs. Now, our positive signs of pregnancy, they're more definitive, where you can actually see that a baby is growing inside of a woman. So, for example, you have your Doppler ultrasound, a fetal x-ray, or a fetoscope. Now, we need to go over Nagel's rule because this will give us the estimated delivery date for that baby. Now, in order to do this very important rule, you will need to know the last date of the menstrual period. Now, NCLEX will give you that date, so all you need to do is plug in our formula, which is to add 7 days, subtract 3 months, and then add 1 year. So let's give it a try. If the last menstrual period was May 5th, 2018, when is that estimated delivery date? Do you have it? The correct answer is February 12th, 2019. And you know what? Sometimes to make it easier on myself, I will turn the month into a number and subtract 3 from that number. So, for example, May is represented by the number 5. So I would subtract 3 from 5 to get 2, and I know the month that goes along with number 2 is February, and then I would just proceed from there. That's my easy trick to do Nagel's rule. All right, next let's talk about monthly doctor's visits. You want to know this schedule, so I'm going to break it down into 3 categories, and then I'll also tell you important milestone markers for the fetus during those months. So up to 28 weeks, the mom is going monthly for doctor's visits. And at 16 weeks, lanugo is formed on the baby, which, if you aren't familiar with lanugo, it is the fine baby hairs that will cover the entire body. 28 to 36 weeks, you have bi-weekly doctor's visits. So every 2 weeks, a mom is going to the doctor's. Did you know at 28 weeks, the alveoli begin to develop and surfactant is actually produced in the fetus's lungs? Surfactant is so important because it allows for lung expansion to take place. 36 to 42 weeks, a woman is going every week to see the doctor. So there will be weekly doctor's visits. And at 36 weeks, there is rapid fat production in that fetus. Another term I want you to know is called lightening. And lightening is when the fetal head drops down into the pelvis so that the baby can enter into its final birthing position. These are your monthly doctor visits. Let's move on to two very important terms that you want to make sure you know the difference between before taking your NCLEX exam. They are gravity and parity. Yes, know the difference between these two. Gravity, number one, it is the number of pregnancies that a woman has had, even if that baby was not born. So that includes any abortions, any miscarriages. Whereas parity is the number of pregnancies that have been carried to term, right? Meaning that the baby is able to live on its own. Now, what I want to ask you is this. If a woman has 4 children, 2 single children, and a set of twins, what is her parity? Is it 3 or is it 4? What do you think? Yes, the correct answer is going to be 3. Because remember, even though a woman was pregnant with twins, her pregnancy is still just counted as one pregnancy journey. So if she has 2 singles and a set of twins, then her parity is 3. Let's go over some diagnostic procedures that are important to know during pregnancy. As a registered nurse, you definitely want to know about the amniocentesis. Yes, an amniocentesis is done for 2 reasons. The first one is you want to know about the fetal lung maturity. The second is that you want to know the overall well-being of the baby. Let's look at the administration and then some client education points. The amniocentesis is normally done at 16 to 20 weeks. And it's only done if a woman meets certain criteria. So this is not a procedure for every pregnant mother. And the reason is because it is an invasive procedure, meaning that with an amniocentesis, there will be a needle insertion into the abdomen. Our client teaching points are 4 of them that I want you to know. Number 1, a written consent is needed for this procedure. The second is that the woman must empty her bladder before the procedure is done. You guys know that a full bladder can actually misplace the uterus, which you don't want during this procedure. Everything has to be very precise to make sure that that needle gets into the right location. So, our third teaching point for registered nurses is that an ultrasound will be done to locate the uterus and the placenta of the baby. Number 4, vital signs and fetal heart rate are monitored during this procedure. During the amniocentesis, you want to watch for premature rupture of membranes, also decreased fetal movement, and third, infection. Oh, our next diagnostic procedure is all about the Rh immune globulin. Now, the Rh immune globulin is given when, this is the indication for it, this is given when the mother is Rh negative and the baby is Rh positive. Now remember, the immune globulin is a protein that is found on the blood. Let's go over the administration. The Rh immune globulin is given to the mother, okay? Always given to the mother. Do we ever give the Rh immune globulin to the baby? What do you guys think? No, never. Never give it to the baby or never give it to the father. Now, when do we give it? It can be given 2 times, at 28 weeks and within 72 hours after the delivery of the baby. The client education has to do with the exam or the test called the indirect Coombs test. Now, this is used to determine the presence of antibodies in the mother. The client education has to do with the indirect Coombs test. The indirect Coombs test is for the mom to determine if she has antibodies. The results should be negative. The client education has to do with the indirect Coombs test. A negative indirect Coombs test means that the mother has not developed antibodies against her Rh positive baby. Okay? So we want the test to be negative. And if the exam is negative, then that requires us to give the mom the Rh immune globulin RhoGAM or Rh immune globulin. All right? Another name for the Rh immune globulin is RhoGAM, but for NCLEX, we have to stay away from the brand names. Again, this is given 28 weeks during the pregnancy and 72 hours after delivery. Some people say, hey Regina, how do you give the Rh immune globulin? It's actually given as an IM injection. So if it's given properly, it should not cause that much pain. Now, the last diagnostic procedure that I want to talk about is the non-stress test. There are 3 reasons why a non-stress test is performed. Number 1 is the baby's heart rate is irregular. So maybe it is running a little bit low or it's staying the same and there's very little variation. The second is decreased oxygenation. And the third is fetal well-being. The administration points are typically a non-stress test is done after 28 weeks. And what happens are the counts of the fetal movement are measured. So for about 20 to 30 minutes, you're recording the amount of times the baby moves. You're also looking at the heart rate. There are 2 results for the non-stress test. Either it's reactive or non-reactive. So I want you guys to know that reactive is a negative. And negative is a good thing. It's normal. It means the baby's heart rate is accelerating at a normal pace. Now, a non-reactive non-stress test means the baby was abnormal. There was inactivity. The baby wasn't moving during that time in the way that it should be. So, our client education is to tell the mom that she should eat and drink before the exam. Eating and drinking actually encourages the baby to move. I don't know if you guys knew that. So NCLEX might try to trip you up and say, or ask you, I would say, should the mom be NPO before a non-stress test? And that answer is going to be no. She should eat. The non-stress test is also non-invasive, meaning that there is no risk to the baby or the mother before it's done. We're going to look at 6 points. Let's start with morning sickness.
Okay, let's fill out your workbooks, guys.
Did you know that morning sickness was actually due to hypoglycemia? That's right. The blood sugar drops. And so, just like with our diabetic patients, the pregnant mom will feel nauseated. She will feel weak. She will feel sick. So what do you think we tell pregnant moms who have a low blood sugar. What do we tell them to do? Pregnant moms who have morning sickness, result of a low blood sugar. We tell them to eat dry carbohydrates.
This is page 29.
Just like our diabetic patients, we tell them to go ahead and eat dry carbohydrates. Also, to sit up after meals. When it comes to backache, it is such a common concern for pregnant moms. We tell them to use good posture and avoid spine curving. We tell them not to curve their spine inward. Also, they should use the pelvic rocking technique. Number 3 is leg cramps. To prevent or reduce leg cramps, we tell the mom to dorsiflex the foot. The diet for a pregnant mom should always be high protein with a prenatal vitamin. 5. Anemia is normal during pregnancy. And if you think about it, it's simply because there are more red blood cells required to grow the fetus. Kegel exercises are number 6, and they are used to strengthen the pelvic floor muscles. This is so important for men and for women. Yep, that's right. Men can also do Kegel exercises, but women, particularly during pregnancy, need to do Kegel exercises in order to prevent urinary incontinence. The danger signs in pregnancy. There are signs that will put a nurse on high alert for a pregnant mother. The first one is sudden abdominal pain.
Oh.
Number 2 is
y'all want me to let the video keep going? Hearts on the screen if you want the video to keep going.
And 4 is puffiness in the face, hands, and feet. So if a mom typically has puffiness in her lower extremities, but if you start to see her face and her hands swelling, that is a very bad sign. Remember, during this time, if a woman has any of the danger signs, as registered nurses, we would never want to assess her vaginally. There are 2 complications of pregnancy that I want to look at specifically. Preterm labor is one, and then also preeclampsia.
Okay, you got to write fast now.
Preterm labor, let's define it. Preterm labor is any labor before 37 weeks. There are 2 medications I want you to know. The first one is if you give terbutaline, you want to watch for tachycardia in the mom and in the baby. The second is if you give magnesium sulfate. Magnesium sulfate will actually decrease 3 things. And this is very important as a general safety point for NCLEX. Do you know the 3 things? The first one is respirations. That's right. Magnesium sulfate will decrease your patient's respirations. And you will see them decrease less than 12. Number 2 is decrease urine output. And we are looking for a decrease less than 30 milliliters an hour because that's normal urine output, about 30 an hour. The last is decrease deep tendon reflexes. The normal magnesium level that I want you to write down is 1.6 to 2.6. You know what? There's 2 medications that I also want you to know. We're going to add them to the bottom of this chart. If you give Ritodrin, you need to watch for tachycardia and hypokalemia. If you give nifedipine, it will cause hypotension and hypoxemia. The next complication during pregnancy that I want to talk about is preeclampsia. You guys may be familiar with preeclampsia. It's the hypertensive state seen in pregnancy from an unknown cause. So it's high blood pressure during pregnancy, and the cause is really not known. But there are 3 defining characteristics of preeclampsia. Number 1 is hypertension, of course. 2 is proteinuria. What does proteinuria mean? Protein where? That's right, in the urine. Now, should there ever be protein in the urine? What do you think? No, not at all. And the third characteristic of preeclampsia is going to be edema. And remember, I talked about that edema, that puffiness in the face, hands, and feet. Now, there are certain risk factors for preeclampsia. Moms who are under 18 or over 35. Also, women who suffer from obesity,